Diabetes is a chronic condition that affects millions of people worldwide, often manifesting through subtle signs that can be easily overlooked, particularly during the nighttime. These symptoms, while seemingly minor, can be indicators of more serious underlying issues related to blood sugar levels, organ function, and overall health. Recognizing and addressing these nighttime signs is crucial for managing diabetes effectively and preventing long-term complications, particularly those that affect vital organs like the kidneys, heart, and nervous system. One of the most prevalent symptoms among diabetics is frequent nighttime urination, known medically as nocturia. This symptom is directly linked to the high levels of glucose in the bloodstream. When blood sugar levels are elevated, the kidneys, which filter blood, work overtime to remove the excess sugar. This process involves drawing water from the blood to help flush out the glucose, leading to increased urination. This not only disrupts sleep, but also contributes to significant fluid loss and dehydration. As a result, individuals with nocturia often find themselves waking up multiple times during the night to urinate, leading to chronic sleep deprivation and daytime fatigue. The cycle of frequent urination and dehydration can be particularly detrimental, as it creates a persistent state of fluid imbalance, further exacerbating the condition and making it harder for the body to regulate blood sugar levels. Excessive thirst, or polydipsia, is another common symptom that is closely related to nocturia. As the body loses fluids through frequent urination, it naturally triggers a sense of thirst to replenish the lost water. However, in diabetics, this thirst is often insatiable because the underlying issue, high blood sugar, remains unresolved. The body continues to lose water as it attempts to excrete excess glucose, leading to a vicious cycle where the more a person drinks, the more they urinate, and the thirstier they become. Additionally, high blood sugar levels can cause the body to retain sodium, a condition that further exacerbates thirst. Sodium retention leads to an increased need for water as the body tries to balance its electrolyte levels. This cycle not only leads to dehydration but also results in the loss of essential minerals such as potassium, magnesium, and calcium, which are crucial for maintaining proper muscle function, nerve health, and overall bodily balance. Restless leg syndrome, RLS, is another troubling symptom often experienced by diabetics, particularly during the night. RLS is characterized by an uncontrollable urge to move the legs, usually due to uncomfortable sensations such as tingling, burning, or aching. This condition is often linked to a deficiency in vitamin B1, thiamine, which is common in individuals with high sugar intake. Thiamine plays a vital role in nerve function and energy production. When the body is deficient in this vitamin, it can lead to an accumulation of lactic acid in the muscles. Lactic acid buildup can cause muscle fatigue and a lack of oxygen, leading to the uncomfortable sensations associated with RLS. Additionally, magnesium deficiency, another common issue in diabetics, can contribute to RLS. Magnesium is essential for muscle relaxation and nerve function. Without sufficient magnesium, muscles cannot relax properly, leading to the restlessness and discomfort characteristic of RLS. Addressing these deficiencies through diet and supplementation can help alleviate the symptoms of RLS and improve sleep quality. Peripheral neuropathy is another serious condition that often affects diabetics, particularly at night. This condition involves damage to the peripheral nerves, which are responsible for transmitting signals between the brain and the rest of the body. Peripheral neuropathy often manifests as pain, burning, numbness, or tingling in the extremities, particularly the feet. These symptoms tend to worsen at night, making it difficult for individuals to fall or stay asleep. The reason for this nocturnal worsening is that when a person lies down, blood tends to pool in the lower extremities, increasing pressure on the damaged nerves and exacerbating the symptoms. Peripheral neuropathy is a direct result of prolonged high blood sugar levels, which can cause nerve damage over time. Managing this condition involves controlling blood sugar levels and addressing nutrient deficiencies. A combination of vitamin B1 and alpha-lipoic acid has been found to be particularly effective in alleviating the symptoms of peripheral neuropathy. These nutrients support nerve health and help reduce oxidative stress, which can further damage nerves. Leg cramps, particularly in the lower legs or feet, are another common nighttime complaint among diabetics. These cramps are often caused by a deficiency in magnesium, a mineral that plays a crucial role in muscle function. Magnesium is responsible for regulating muscle contractions and promoting relaxation. When magnesium levels are low, muscles can become overly excitable, leading to cramps and spasms. This problem is often compounded by an imbalance between magnesium and calcium. While magnesium promotes muscle relaxation, calcium is involved in muscle contraction. In the absence of sufficient magnesium, calcium can build up in muscle cells, causing prolonged contractions and painful cramps. This imbalance is particularly common in individuals with high blood sugar levels, as the body tends to lose magnesium through frequent urination. Supplementing with magnesium, particularly in the form of magnesium glycinate, can help alleviate leg cramps and promote better sleep. Excessive sweating at night, particularly around the face, neck, and upper body, is another symptom frequently reported by diabetics. This type of sweating, known as nocturnal hyperhidrosis, is distinct from hot flashes associated with menopause. It is often triggered by the body's stress response, which is activated by blood sugar imbalances. When blood sugar levels fluctuate, the body can enter a state of sympathetic dominance, also known as the fight or flight response. This response is characterized by the release of stress hormones such as adrenaline, which can cause the body to sweat excessively. This sweating can occur whether blood sugar levels are too high or too low, as both conditions can trigger the release of adrenaline. Managing blood sugar levels and addressing underlying stress can help reduce the occurrence of nocturnal hyperhidrosis and improve sleep quality. Sleep apnea is another serious concern for individuals with diabetes. This condition, characterized by repeated interruptions in breathing during sleep, is often linked to insulin resistance, a hallmark of diabetes. Insulin resistance occurs when the body's cells become less responsive to insulin, a hormone that regulates blood sugar levels. As a result, the body produces more insulin to compensate, leading to higher levels of insulin in the blood. This excess insulin can contribute to weight gain, which is a major risk factor for sleep apnea. In sleep apnea, excess weight can lead to the obstruction of airways, particularly in the throat and sinuses, making it difficult for individuals to breathe properly during sleep. This condition not only disrupts sleep but also leads to decreased oxygen levels in the blood, which can have serious long-term health consequences, including an increased risk of cardiovascular disease. Hypoglycemia, or low blood sugar, is another condition that can cause significant problems during the night. When blood sugar levels drop too low, the body responds by releasing adrenaline, a hormone that raises blood sugar levels by stimulating the release of glucose from the liver. This adrenaline release can jolt a person awake, often with a sense of panic or anxiety. This nighttime hypoglycemia can be particularly dangerous, as it can lead to seizures, loss of consciousness, or even death if not addressed promptly. Individuals with diabetes are at risk of hypoglycemia, particularly if they take insulin or other medications that lower blood sugar levels. Managing this condition involves carefully monitoring blood sugar levels, adjusting medication doses, and ensuring that blood sugar levels are stable before going to bed. High blood sugar levels can also interfere with the production of melatonin, the hormone responsible for regulating sleep. Melatonin is normally released in response to darkness, signaling the body that it is time to sleep. However, when blood sugar levels are elevated, the release of melatonin can be delayed, making it difficult for individuals to fall asleep. This delay in melatonin release can lead to insomnia, a condition characterized by difficulty falling or staying asleep. Chronic insomnia can have serious consequences for overall health, including an increased risk of cardiovascular disease, obesity, and mental health disorders. Gastric reflux, also known as GERD, gastroesophageal reflux disease, is another condition that can be exacerbated by diabetes, particularly at night. GERD occurs when stomach acid flows back into the esophagus, causing a burning sensation in the chest or throat. This condition is often worse at night when lying down, as gravity no longer helps keep stomach acid in place. In diabetics, GERD can be linked to autonomic neuropathy, a condition that affects the nerves that control the muscles in the digestive system. When these nerves are damaged, the valve between the stomach and the esophagus may not function properly, allowing acid to escape into the esophagus. Managing GERD in diabetics often involves dietary changes, such as adopting a low-carb or ketogenic diet, which can help reduce the production of stomach acid and improve overall digestive health. Nightmares or vivid dreams are another symptom that may indicate a problem with blood sugar regulation. These are often linked to a deficiency in vitamin B1, which can be depleted by a diet high in refined carbohydrates. Vitamin B1 is essential for the production of neurotransmitters, which are chemicals that transmit signals in the brain. When the body is deficient in this vitamin, it can lead to an imbalance in neurotransmitter levels, resulting in disturbed sleep and vivid dreams or nightmares. Addressing this deficiency through diet and supplementation can help alleviate these symptoms and improve sleep quality. Blood pressure that does not dip during sleep, known as non-dipping blood pressure, is another common issue in individuals with diabetes. Normally, blood pressure decreases during sleep, a phenomenon known as nocturnal dipping. However, in diabetics, blood pressure may remain elevated or even increase during the night. This condition is often linked to autonomic neuropathy, which can affect the nerves that control blood pressure regulation. Non-dipping blood pressure is associated with an increased risk of cardiovascular disease and stroke, making it a serious concern for individuals with diabetes. Heart palpitations, or an irregular heartbeat, are another common symptom among diabetics, particularly at night. These palpitations can be caused by an electrolyte imbalance, specifically a deficiency in potassium and magnesium. Both of these minerals are essential for proper heart function. Potassium helps regulate the electrical activity of the heart, while magnesium helps maintain a regular heartbeat. When these minerals are deficient, the heart may struggle to maintain a steady rhythm, leading to palpitations. Supplementing with potassium and magnesium can help reduce the frequency and severity of palpitations and promote better heart health. Teeth grinding, known as bruxism, is another symptom that can occur due to the body's heightened stress response during sleep. This involuntary grinding of the teeth can lead to dental issues such as worn enamel, tooth sensitivity, and jaw pain. Bruxism is often linked to the stress caused by blood sugar imbalances, as the body struggles to regulate its internal environment. Managing stress and blood sugar levels can help reduce the occurrence of bruxism and protect dental health. Morning headaches are another common complaint among diabetics. These headaches are often a result of dehydration, a common issue in individuals with diabetes. The brain requires adequate hydration to function properly, and when it is deprived of fluids, it can lead to headaches and a general feeling of discomfort. Addressing dehydration through proper fluid intake and managing blood sugar levels can help reduce the frequency of morning headaches and improve overall well-being. In conclusion, the nighttime symptoms associated with diabetes are diverse and complex, ranging from frequent urination and excessive thirst to restless leg syndrome, peripheral neuropathy, and sleep apnea. These symptoms are often interrelated, with one issue exacerbating another, creating a cycle of poor sleep, fatigue, and declining health. Managing these symptoms requires a comprehensive approach that includes dietary changes, supplementation with essential vitamins and minerals, and careful monitoring of blood sugar levels. While addressing these issues can be challenging, it is crucial for preventing long-term complications and improving the quality of life for individuals with diabetes. In summary, these nighttime signs of diabetes shouldn't be ignored. Recognizing and addressing them early can make a significant difference in managing your health and preventing serious complications down the road. If you or someone you know is experiencing any of these symptoms, it's essential to take action. For more tips and insights on health, be sure to like, subscribe, and click the notification bell to stay updated with our latest content. Take care, and thanks for watching.